Hello, and thank you for joining us for ROI and VOI or Goodbye, a smart approach to vendor management, part 2 of Hub's 3-part cost management webinar series. We appreciate the time you set aside today to attend this event. In today's session, we'll explore cost containment from a vendor management standpoint, looking at how to maximize your benefit dollars by reducing vendor redundancy. Our expert panel will offer up strategies and data-driven insights to help you assess vendor solutions for true impact, eliminate inefficiencies, and ensure your investments align with your organizational goals. You'll come away with a better understanding of how to streamline your benefits administration and make strategic vendor decisions that drive real value for your organization. Before we jump into our topic today, we recognize that there's a lot happening in the world. We understand that it's not just about benefits or cost management strategies. As business leaders, you may be thinking about risk mitigation strategies that can position your organization for success in the short term as well as the long term, and help you navigate a constantly changing landscape. Hub is here to be your partner in these uncertain times. Just a couple housekeeping items. We are recording this webinar and we'll send a link to the recording to everyone registered within the next day. Time permitting, we will try to address submitted questions in our Q&A section near the end of the presentation. After the webinar, you will see a survey pop up before exiting. Please take a few seconds to fill this out. We greatly appreciate your feedback. Now I want to introduce our panel of experts. First off, I'm Sarah Collins, Employee Benefits Director of Strategy and Key Accounts with Hub International. Joining me are my colleagues and friends at Hub. Dennis Batista, Senior Vice President and Data Analytics Segment Leader, Ashley Mayberry, Director of Clinical Informatics and Clinical Consulting, and Fran Scott, National Health and Performance Practice Leader. Here's a quick look at what we'll be covering today. First, we're going to take a look at the cost management landscape before turning to a discussion on ROI and VOI and point solution overload. Next, we'll examine a client case study to help demonstrate how all this plays out in real life. And then we'll look at how data validation and clinical tracking come together and illustrate how a multidisciplinary approach maximizes cost management efforts and helps you make the most of your benefit dollars. Before we get into our panelists, let's review why this is such an important topic for organizations. Growing pressure to justify employee benefit spend while healthcare costs are constantly increasing. Lack of vendor oversight and accountability can lead to a lack of engagement, integration misses, and of course, negative budget impacts. Also, ROI doesn't tell the whole story. VOI is crucial to painting the entire picture of the vendor landscape. Today's goal is simply to button up the vendor management and see improved results across the board. And now I'd like to turn over to Fran Scott to help us unpack the concepts of ROI and VOI and why you should be tracking both.
Thanks, Sarah, and great lead off into starting off this discussion to define the terms and further emphasize why it's important for employer groups to use both as evaluation frameworks. So first, ROI, return on investment. These are the measures of financial impact of a solution that tend to be around claims data, absenteeism, cost trends in general, versus VOI or value on investment, which measures broader impact around things like retention, culture, and engagement. And as Sarah mentioned, we at Hub think it's important for groups to be measuring both and using both in their evaluation frameworks of their vendors. And so who might be interested on either side? On the next slide, we show you an illustration of CFOs might be, and financial teams are most interested in the financial outcomes, the cost savings, the ROI, forecasting risk, etc. While CHROs and HR teams have a vested interest in employee engagement around VOI, value on investment, the employee experience. And it's not to suggest that one group might not have a mix of interest across those two frameworks. We just want to draw the attention that having both is important and finding the right mix of those measures for who's in your audience as you're reporting on your outcomes is really important. So we want to unpack a little bit into the health and performance space as it relates to population health. So on the next slide, we have an illustration to show ROI methodologies to unpack this a little bit further. So when groups come to us and they ask for, what's the ROI in that solution, they're really probably most often thinking of the best case scenario. And unpacking ROI a little bit deeper, I want to just share with you that there's a range of efficacy of these measures from acceptable to good to better and best. I'm just going to frame this up by sharing with you on the bottom row, a time one, time two analysis. Matched cohort analysis is what a true ROI is measuring, the difference between two different groups going through a solution experience and the measurement of their medical claims and RX comparatively on a matched basis. On the other end of the spectrum, we have the minimally clinical important difference that might come from a vendor solution. And so just to provide a little bit more insight onto that, we have two examples, one from Hinge Health and one just a sample of a draft of ROI analysis on the next slide to show you on the left side, showing you an example of that MCID or medically clinical important difference. This would be an example that a solution such as Hinge might use to suggest to an employer group that those whose pain reduces by a certain percentage meet a threshold of pain reduction that larger study sets suggest lead to lower procedures and pills needed to manage that pain. So when they have a percentage of the population that meets that threshold of pain reduction, they extrapolate that data up to the larger data sets to suggest that that would be the reduction in cost unforeseen that you would otherwise have experienced if they hadn't gone through that solution. So we consider that to be an acceptable measure. There are some things that you have to assume to be true in that case. On the right-hand side, we're unpacking further that true matched cohort case analysis. And in this instance, what you're doing is taking two populations and matching them in certain demographics such as gender, age, risk factors, and then measuring their claims and RX experience, and then putting them through a solution, such as in this example, maybe Hinge Health or a diabetes program, and watching those two groups across time. And over the course of 2 years, 3 years, what you should see happening is that those who are engaging the solution are having a flatter claims and RX experience versus those who are not engaging. And that gap in spend, the spend that doesn't happen, is then used to analyze the return on the investment. So for example, if the savings, the gap in savings was $100,000 between the two groups, but the solution cost $50,000 just to keep the math simple, that would be a 2-to-1 ROI. So that's a true matched cohort case analysis. We know that not every group is in a position to do that sort of a measurement. You need to either have a vendor in place that can do the measurement for you, the analysis, or a data warehouse and such as hubs that can provide that analysis for you. So just wanted to start off the conversation by level setting around that. And we're going to leave you with one more framework around population health that shares that the best practices around population health include those that you see listed on the next slide in the upper left corner. And so while today we're focused on programs and measurement and evaluation, in the greater context of all of the best practices associated with population health, we want to just illustrate that we know that there are more things that lead to success, not just the program and the evaluation of those programs. So wanted to provide that context. And additionally, along the population health scale from well to catastrophic illness, today we're going to be focusing on solutions that would impact those who are at risk with chronic illness and catastrophic illness. And again, the last thing that we'll mention one more time is that having an evaluation framework that includes both ROI and VOI is critically important. So let's move on to the next section where we'll just start to paint the picture of the issues that's at hand. As Sarah teed up at the beginning, point solution overload is really quite common for our groups. So the problem is, as Sarah teed up at the start, high trend and repeated year over year. Some of our clients had double-digit renewals, and that seems to be the pattern that has been continuing and has become quite unsustainable, resulting in increased costs for the employers and also their employees. So while that's the problem, we also know that part of the problem is that we illustrate on the next slide that there are so many solutions, and those solutions range from everything on risk solutions, better rates, and member steering. Today, we're going to be focusing on those vendors that impact that right-hand column or the illness burden that your employees might be facing. And so what we're just illustrating here is that the part of the problem is that there's so many solutions. How do you prioritize? How do you identify the right solution set for the right group decide to invest, and then manage that investment so that you're making sure that you can apply those evaluation frameworks at the end of each year with that vendor. So I'm going to hand it over to my colleague, Dennis, and he's going to share a real life example, case study that will help to illustrate these principles.
Thanks, Fran. And as Fran indicated, I'm going to actually give you a real case that is actually a customer that I personally worked on. And so before I get into the detail, I just want to kind of set it up on what I'm trying to do here. I'm going to set it up first with giving you the environment. What was the challenge? What was the issue we were trying to resolve in regards to point solutions? And then I'm going to go ahead and talk about how we measure the efficacy of the program. And then I'm going to close it off with what were the actionable items that we had our clients do to either support or modify their program. Okay. And then I'm going to also start it with this. I'm going to approach this from a financial perspective because I am not a clinician, but as if you remember from the order of operations here, I'm going to pass it over to from a clinical perspective, but that's the way we're going to close off this session. So let's talk about the environment. So this client that I worked on personally was a manufacturer, over 2,500 employees, has a union involved. It was an aging population. Geographically speaking, they were located throughout the United States, primarily in the Midwest. And the challenge that we had was vendor overload, low engagement in these programs, and underutilized programs. Okay. And so when we talk about point solutions first, I want to make mention of this. There are a lot of point solutions out in the marketplace today, and it could get overwhelming. And so my teams, me specifically, in order for me to make the right recommendations, we had one process that I wanted to follow, and that was to let data lead to the solution, right? And so when we look at the bottom half of this page, we're going to look at the top three gaps, and I'll label it for you. Diabetes and hypertension to begin with, preventive care, and then MSK, which stands for musculoskeletal, and then surgery support was the third leg, okay? When you look at the aging population, this wasn't surprising, right? Diabetes and hypertension, we noticed there was low enrollment. And when we're looking at the efficacy of the program, we wanted to approach it from a financial perspective. And the financial perspective was, could we improve the program and what were the measurable missed opportunity costs? So for diabetes and hypertension, we're looking at low enrollment. As I've indicated, we had $300,000 in missed opportunities there. For preventive care, it was also underused. We saw an opportunity cost of $150,000 that was missed. And then the largest one was musculoskeletal and surgery support, had very limited participants. We saw a miss of nearly $400,000 in this category. And so before closing this page, as you can talk upon, despite good intentions and a suite of these solutions, this organization did leave money on the table that we thought that we could improve. So advancing to the next page. So now it's how did we measure this? And the audience that I had in this organization with this meeting was with the CFO and also with the CHRO and everybody in between. And so I needed to really fulfill the needs of every audience, but I wanted to focus on the financial perspective. And the only way to get them to understand was to really provide a scorecard, right? And so the way we looked at missed opportunities was engagement. And you're going to see two bar graphs here. One bar graph represents their actual engagement rates or the number of people enrolled into these programs. And then the second bar chart is actually from the commercial carrier's book of business. We were looking for benchmarks for organizations in the same industry, almost the same exact size, right? And so let's start with diabetes first. With the data that we saw in terms of engagement rates, we saw 2 out of 10, 20% engagement rate for the diabetes programs, where the benchmark was 30%. The missed opportunity cost there was between $200,000 and $300,000. And then advancing to preventive care, a little larger of a delta here. The actual data pointed to a 68% engagement rate, where the benchmark was near 80%. a missed opportunity cost of about $150,000. And then the largest one, which is not surprising, was surgery and decision support. And so in this manner, when we looked at the data, the engagement rate for this program was less than 1%, where the benchmark was 1 out of 3 or 33%. The missed opportunity cost here was on the low end, 150,000. It was actually a little bit more than that. But when you look at the entire ecosystem of the opportunities, that's where we get the $1.7 million delta, right? And engagement does matter, okay? And why is that important? If I can put it in layman's terms, is because when we consume healthcare or when we seek medical services, Point Solutions doesn't just answer when, but how, right? So to give you an example, for diabetes, for instance, right? If you're pre-diabetic, more than likely you're seeking service from a primary care physician. And there could be some things that could happen from whether or not, if you're pre-diabetic, this could be maybe taken care of with maybe nutrition, could be diet and exercise before it gets to a medication protocol. But if you wait and actually then seek the services of an endocrinologist that focuses on diabetes, well, when you enter the medical system, that's at a higher price point. So the timing of when you enter or how you use medical services is going to be critical. And that's what Point Solutions programs do. So in this example, we looked at opportunity costs to provide guidance to our clients to let them know whether or not this investment was worth it and what we needed to do to improve the outcomes going forward. So, and I'll explain that in the next page. So here was the framework that we used, right? And so we just talked about the assessment part of it. And as I mentioned earlier, it was more of a finance type discipline. Optimization was really outreach. Remember when I talked about engagement rates? Well, that isn't just on the program itself, right? Engagement rates has a lot to do with the environment, the ability for the program to outreach to the employees. So we saw an opportunity there. And then enhancement, using these scorecards, our ability to measure the efficacy will provide, in my opinion, our client the ability to give them the steps needed to improve the program. Right? And I'm going to show that to you in the outcome. And so the next page will actually talk about those to-dos, right? And this is exactly how we ended our study and our conversation with our client. And in the upper part here, this organization, we told them, like when we introduce the program, it has to start from the top. So leadership needs to be really engaged. And the meeting that we were having at that point in time was to give them an assessment of the effectiveness of the program. We knew that there was going to be an HR summit coming in September of that year, and we saw that as a perfect opportunity to then continue to communicate the program. In the middle part, we put here, leverage this care coordination program on other health partners. This is complex, right? You've got a large self-funded manufacturer with a commercial carrier with a care coordination program with multiple vendors regarding Point Solutions. So this coordination of care across that entire ecosystem was incredibly important. So we needed to leverage off of them as well. So we talked about increasing the complete contact information. We talked about engagement earlier. We needed to have updated phone numbers, updated addresses. You cannot take for granted that changes at times happens, but if we can't get in contact with the member, well, then the program in itself gets watered down. So we wanted to make sure that we improved engagement rates. And then the last part of here is the communication plan. This is really harnessing Hub's ability to put assets out there for proper communication, right? So we use the wellness and communication funds that we were able to negotiate with the commercial carrier and use that for a marketing campaign. We did that through calls and through other literature. There were surveys, right? We wanted to make sure that the employees understood that this was a very important investment for the organization. So we wanted to assess how they felt about it. And then lastly, use some of the on-site posters, right? Because they were scattered throughout not only the grounds, but also throughout the US. We wanted to make sure we had consistent and actionable items for them to take advantage of. And so, as I mentioned earlier, this was the financial perspective of how we measured the efficacy of a program, but it does not address the clinical side of the equation. So with that, I'm going to pass this over to Ashley to talk about the clinical perspective regarding vendor solutions.
Thank you, Dennis. So yeah, now we have arrived at the clinical approach. So everything we've discussed previously from Fran and Dennis. So that 1.7 million in missed opportunity, the vendor overload, and then the need to balance that ROI, VOI. But the challenge is, how do you turn that financial data into clinical action that drives those results? So this is where the clinical approach becomes very transformative. So data validation and clinical outcome tracking, they're not just analytics, they're the bridge between knowing we have a problem and then actually trying to solve for it. So here's where we bridge that financial data with the clinical action to address that missed opportunity. So kind of getting further into these details, we're going to kind of focus on the main challenges. So converting the missed opportunity costs of that 656,000 in CT scan surgeries into those targeted clinical interventions, drawing on that household engagement, and then aligning those existing frameworks to maximize that ROI. So the first thing is identification of the problem, right? So finding members with the conditions like diabetes or hypertension who weren't getting required follow-up care. When comparing these gaps against those benchmarks, and we applied actual procedure costs to help create those targeted outreach and care navigation strategies, this now automatically makes us actionable because we've identified that higher risk cohort that needs that specific intervention to prevent costlier complications down the road for untreated or early complicated diseases. That 48.8% company-wide engagement, that becomes now my clinical intelligence. So we tailor strategies by location based on high engagement areas where they get one approach, and the low engagement areas get a more intensified strategy, personal outreach. And then the 6 digital health solutions get that optimized version through clinical strategy rather than replace. So how do we optimize what is currently existing? So the financial data identified the gaps, and now clinical informatics provides that targeted solution path. So now we're going to explain how this works in practice with the real client challenges. So leveraging hub-infused analytics, we address this client-specific challenges through our clinical strategy team and H&P collaboration model. So we leveraged evidence-based interventions from financial data, operational implementation for diverse facilities, and joint quarterly reviews, creating that mutual accountabilities across hubs teams. So that population health insights, vendor performance scorecards, predictive cost modeling, and the program feasibility assessment. So with population health insights, ABC's diverse workforce across those multiple locations gets risk stratification by those locations to target the higher risk cohorts. So location A may need diabetes focus, where location B may need a more musculoskeletal approach. The vendor performance scorecards, so those 6 underperforming digital health solutions now get evidence-based evaluations to prioritize the highest ROI potential. So while we may optimize some, replace others based on those proven outcomes, is something that us as a multi-collaborative team then help make those recommendations to the client on. The predictive cost modeling, that 1.59 to 1.7 million in missed opportunities, now becomes our baseline for that intervention impact forecasting. So improve that diabetes engagement. Here's what we expect from that clinical and financial return based on those engagement values or solutions. And then the program feasibility assessment with that 31.9% to 77.3% engagement variation, we now model that resource allocation that aligns with each location specific needs. So we are providing very client specific strategic recommendations. So using hub-infused analytics now helps us transform that data into those targeted intervention strategies that drive those measurable outcomes. So now let's get specific about vendor optimization. So point solution optimization, we essentially use our 3-phase approach. We've got the assessment phase, our optimization phase, and our enhancement phase. So the assessment phase is basically clinical evidence review plus that financial opportunity sizing. We don't just look at utilization. We review clinical literature. We compare outcomes to benchmarks, and we quantify those improvement opportunities. Our optimization phase is now location-specific implementation strategies. So for this particular client, the musculoskeletal program may work at the headquarters, but may also struggle at remote facilities. So now we've developed that tailor approach for each location based on those workforces and those barriers that align with each. And then enhancement phase, these are our predictive models for future risk patterns that with that continuous ongoing refinement. So what we anticipate, when, where, and why. And then each vendor gets assigned to that specific measured domain with those clear clinical strategy roles. So diabetic partners focus on those clinical outcome trackings, where our MSK partners on more those program feasibility or surgical support on those financial performance with ROI timeframes. So the systematic approach ensures every vendor relationship contributes to measurably both clinical and financial performance. So here's how we're going to translate that into practical implementation using that multidisciplinary approach. So one thing about the multidisciplinary approach I will preface with is any success and any benefit requires that integration across clinical expertise, that operational reality, and that financial accountability. So breaking the silos. The multidisciplinary approach recognizes that the best clinical strategy doesn't succeed if it doesn't align with operational constraints and financial objectives. So success really depends on that three-way alignment. The clinical expertise kind of focuses on what to do. H&P defines on how to do it. And then our finance team validates why it matters. So clinical expertise on that what to do, it's that evidence-based intervention using that peer-reviewed research and that population health data for that specific workforce for this particular group. Then we kind of bring in our H&P consultants to define how to do it. So translating that clinical strategy into operational realities for this particular group across their manufacturing facilities, accounting for those union agreements and those shift patterns and that workforce culture. And then finally, but not last, that financial team to validate why it matters. So ensuring every intervention has a clear ROI and that financial accountability. So the key to success is that shared responsibility, as well as that strategic alignment and that continuous optimization across that multidisciplinary approach, which then creates that integrated accountability where we have that clinical performance, that operation efficiency, and financial results that are inextricably linked to transforming this particular client's missed opportunity into measuring that value creation. So now we've demonstrated how to transform that ROI and VOI dilemma through clinical strategy, those data-driven optimizations, and that multidisciplinary implementation. So we've taken this client's journey from that 1.7 million in missed opportunities to that strategic value creation to show there's a third option beyond that vendor overload or arbitrary cuts, essentially transforming through that integrated clinical approach that delivers those measurable results. So now I'm going to hand it over to Sarah to end on our final presentation.
Perfect. Thank you. Wow, guys, that was a lot of information. So I'll try to summarize it up for everybody. So here's what we've learned today. So we've learned vendor presence does not equal vendor performance. I think that's a really important thing to remember when we're talking about all the vendors that live in our space, that just because they're there does not mean that they're performing, which is the whole reason we're talking about this today. The vendor overload drains time, money, and engagement, and gaps in participation can cost 6 figures or more per condition. You have to remember that all vendor value is visible in ROI alone. VOI provides the complete picture. So having both of those in place, ROI and VOI, is extremely important. Data-backed evaluation reveals gaps, redundancies, and areas for consolidation. Coordinated financial and clinical strategy drives better ROI and VOI. And of course, with the right data partnerships, you can reclaim missed value. So with that, we're going to look at some next steps. So what can we do going forward? All right, so some next steps that we can all take once we leave this webinar today. So do an inventory of your current vendors. Align your key stakeholders. Make sure the right people are in the rooms. Evaluate for overlap and underperformance. Create a scorecard and timeline. How do we manage and how do we score these vendors? And how do we keep them accountable for what they're supposed to be doing for us? Apply ROI and VOI metrics. Of course, engage an analytics partner and look for those missed opportunities. So really at the end of the day, we're all here. We want to start with clarity and end with impact, which I think is really important as we leave this webinar today and get into some potential questions for the group. So before we flip over to some questions that we could have, I have some questions for you guys. So this was some really good insight. I am blown away by everything you guys have told me today and learning more about ROI and VOI in the vendor landscape. There are some themes I've heard today, and I would like it to unpack that a little bit. So one of the big terms I've heard since we've been chatting is the term overload. So if you could please each tell me a little bit more about what that means in your discipline, that'd be amazing. Fran, can we start with you?
I'll take the first swing at this question. So vendor overload in my space specifically might look a variety of ways, many of the things that we touched on today. But for example, a client might be trying to decide on should they pick a solution, vendor solution that impacts just one condition, such as MSK or diabetes, or should they consider a solution that is polychronic that might address those two and weight management, for example. So it can happen there. It can happen in redundancy, so having a carrier solution and then also a point solution that might have similar capabilities. So there's, as you saw in the slide that showed the many hundreds of vendors that exist in the comprehensive well-being and population health management space, it's easy for there to be overload. And so I think your steps on the last slide really did a great job of outlining the way a group should be thinking about it strategically and avoiding that scenario.
And then Sarah, for me, vendor overload, I get this question asked quite often. I mean, most commercial carriers, and you'll get other folks reaching out for pitching why their program is the best, right? And so really as consultants, you need to have really good knowledge of its efficacy. Hence the reason why when Ashley talked about the interdisciplinary approach and the way we collaborate, you'll get a good feel for which ones of these point solutions is going to be able to be successful in the program that you wish, or the outcome that you're looking for. Okay, so for me, it's really getting real. And I made mention during my section about just using data to start it off. Right? And so, more often than not, I get more of the, hey, should I even consider this? And yeah, we may have it. And I look at them, well, you know what? It may happen in the next few years, but for right now, I just don't see it being effective, right? And so it really just comes down to timing. If you want an immediate impact, stick with the data. The data will typically not lie. It'll give you a really good set of breadcrumbs to follow.
Ashley, do you have anything to add from your perspective on the clinical side?
Yeah, so typically from a vendor overload from that clinical lens, to me kind of means similar to what Fran has said, having multiple solutions treating the same patient condition without really talking to each other, thus creating that fragmented care. And confusing the members on the plans. So instead of coordinated treatment, you get this kind of clinical chaos that can actually worsen health outcomes because patients either receive mixed information or they don't know how to navigate the system. So they completely just drown out what is actively available to help them from that health perspective and support. So it almost overwhelms themselves where it actually can worsen participation engagement because of the confusion and mixed information. So, also kind of leveraging a little bit what Dennis kind of hit on. Yes, the data tells a very interesting story. So making sure that you're aligning that with those strategic data-driven discussions is going to help kind of narrow a lot of that in, and not really water down the message that's being said. Also, using it to track that ROI, VOI, making sure that, what is currently being recommended is actually doing what it's supposed to do. And how do we get members on the plan to participate that by using other data points, around the culture, the locality. So where these people live, eat, and breathe, that social determinants of health, that geographic determinants of risk, and applying it to not just the chronic prevalence within the data or the utilization, but also bringing in these environmental factors to try and better understand what are these individuals willing to participate in. What do we feel they would benefit best from? And do the conditions align with what we are actually recommending?
That's great. I really appreciate all of that insight. The other thing I'm thinking about as we're talking about all of this is the evaluation framework process. And, once you're looking at the ROI and VOI of the vendor programs, and we're going to touch a little bit on engagement in a second because I had some other thoughts come up on that. But talk to me a little bit about the evaluation framework and how that works in each one of your areas.
I'll start with that one. So for our practice specifically, it really comes as a part of our discovery conversations with our clients to figure out what it is that they're trying to accomplish and their commitment to their program efforts. And then we can help them determine what the strategy looks like in terms of what's the vision, what are they trying to solve for. And then very naturally, the key performance indicators and the evaluation frameworks that match that North Star, if you will, is where that all fits together. So, I have some clients, frankly, who ROI is not really their most important goal, that their most important goal is the VOI side because they're much more intent on solving for culture, engagement, employer of choice. So in that case, if that's what the group is really focused on and that's what the strategic frame is around, then we probably have more heavily favor in terms of the VOI type of evaluations. But again, we always try to keep a mix. So at a minimum, we want to have some basic measures of ROI around, closing gaps to care, for example. But so that's for us, that's where it happens in our process, and really try to help clients understand how it's measured and what they're actually, able to reach based on their commitment and strategy.
Yeah, Fran, I really love that, your perspective on that, as if I'm going to try to answer this question, because it really just comes down to the audience and what you're trying to solve, right? I mean, there are going to be decision makers that are really finance focused. And if that's the case, you need to stay really disciplined in that lane, right? And knowing that an ROI is going to be preeminent, and you should have conversations of such. But then even within an organization, there are going to be other key decision makers that are also keen on that, right? So we see that dynamic happening all the time. You've got to be able to please every constituent in the meeting. And so your ability to really have stage presence and knowing that you've got experience is going to be a part. So when I talk about evaluation, I always ask, what is it that you want to get out of this program? That's where I start out with. And how are decisions being made in your organization? And from there, we can literally structure a framework in which decisions are made. We can create teams, and we talked about that. Who needs to be involved from the hub side to make sure that the story is being told right? And then on top of that, all of their vendors, right? The vendors, the carrier, every constituent on that side of the equation that also needs to be involved, because at the end of the day, they too are a key stakeholder in the success of any of these programs being rolled out. Does that make sense, Sarah?
Yeah, absolutely makes sense.
Great points.
Yeah, and then I'll add from the clinical side. So, bringing not only the financial, that ROI versus VOI, for clinical, it's understanding what is the client's goals. And sometimes the client doesn't even understand what they really need. So again, leveraging that data to tell that story, whether it be financial, clinically driven. I've had several clients where they're like, we have no idea where to start. You get into the data and you identify areas of key concerns that they didn't even know they were having. So again, not only bringing that wide lens of all these various different viewpoints to the table to make sure, one, culturally, is it appropriate? Two, do the conditions support what you're recommending? And three, that vendor overload, to Fran's point, is a very real thing. That's where her team is, instrumental in a lot of these decisions, because while clinical does look at vendor solutions, and we do vet certain vendors, they are mostly based on clinical driven outcomes. So while we have a small lens into what is currently available on the market and what we know has worked in the past may not necessarily be impactful to the current client situation. There's going to be various levels of details and goals and discussions that we have to narrow that down to ensure that we align them with the best vendor that fits various levels of their population, as well as them as an employer, whether it be cultural impact, again, that ROI, VOI. But again, how do we also optimize that and continuous ongoing management of that particular program? So just various levels of looking at this and aligning those discussions from the hub team through that multidisciplinary approach to make sure that it does fit what the client and the population on the plan actually needs.
That's great. Thanks, Ashley. And I think too, just listening to what you all are saying, thinking about engagement, we're talking about the vendors, talking about the ROI, the VOI on the vendor space. How do we make sure that there's the engagement's happening too? So what are we doing and how are we gauging the engagement? I know, Dennis, I heard you talk a little bit about what you think engagement is, but what do the rest of us think about engagement on this platform and this side of the house?
You're giving me an opportunity to bring up best practices again. So when we have clients that are really understanding best practice, it's not just the programs and the evaluation frameworks, the measurement strategies, as I illustrated on that best practice slide. Those are important. They are key best practices, but they don't stand alone. So another best practice, participation strategies. What does your communication look like? Organizational and leadership support. Do you have a well-being champion committee? Do you have leaders being held accountable for engagement? It can't be programmatic and stemming just from the HR team. It has to be a broader strategic cultural initiative tied to the organization's priorities. So, we work really hard with clients to make sure that their vision of their well-being program is tied to those organizational priorities. So if they've got a people strategy or an employee value proposition, it's important to tie their well-being efforts to that so that leaders can be part of the solution set. Now, they're not the ones up, standing at the water cooler necessarily prompting employees to engage, but having that be a priority for them, holding their middle managers accountable for engagement, et cetera, is the way that a whole ship can rise. If it stems only from the HR or the benefits team programmatically, that's where we see really, I don't want to say failed, but really low engagement programs as a whole. So really go back to best practices and look at the wider lens of the things that drive successful programs. And that will really paint the picture of the other things that a group should consider doing.
And kind of adding to what Fran said, absolutely, from the clinical lens, bringing in the generational and gender norms. If you've got a predominant male population, how do you tailor a vendor point solution to individuals statistically that don't really get proactive with their own healthcare? They usually wait until we have a catastrophic event, which they end up in the ER, they get that quick fix, and then they're out the door, right? They're back at it. So really making, to what Fran said, understanding that wider lens of that cohort to make sure that those discussions are being had and we are targeting those specific individuals appropriately, essentially. So.
Wow, you leave me lost for words. I think that was the most two complete answers I've ever heard, but you guys are stealing my thunder. But Sarah, to answer your question, it's paramount. Engagement is paramount because these programs, they will not work unless the individual themselves are engaged and also supporting the entire initiative, right? And so when I talk about from the top down in my example, there needs to be, it's a part of a company culture, and it starts from leadership, right? Because when we talk about engagement, and I've known this for as long as I've been in the industry, is that people will change when they're ready to change, right? And not everybody's going to change at the first attempt. It could be the third attempt down. You just need to be there when they're ready, right? And so when you talk about any of these programs, the ability to support, the ability for the organization to continue to hammer it home to their employees is going to be critical for the effectiveness of the program. So it's paramount.
Perfect. I love all of that. Engagement, as we all know, is so important. So thank you all very much for answering my question and talking about that a little bit more. I really appreciate it. I think last but not least, it would be great to hear from each of you of what's the key thing or the most important thing that we should have everyone take away today?
I'll start one more time. I think a takeaway is recognizing that you're not alone in this sensation of vendor overload and solution overload. And so one sort of mantra that I like to leave clients with is culture, strategy, vendor, in that order, so that you're making sure that you're in a healthy culture before you're even thinking about implementing a vendor solution, having a strategy, so you're defining what your North Star is and what then your evaluation frameworks are and how to make sure you have the right solution dose, if you will, for your population, and then vendors that fit that. And if you follow that methodology or mantra, culture, strategy, vendor, it can really kind of reduce the noise around lots of what we talked about today and help you sort of sift through to make sure you're following that process before you're quickly, sort of relying on your vendors to be the be all end all of all the things that you do. I think that's a great way to approach it.
And I'll go second. My remark is this: there's a lot at stake, right? Healthcare costs are rising at a faster clip, and at times, making plan changes or introducing new plans can certainly be the low-hanging fruit at times, but it is not the end solution, right? There are other solutions that can certainly help in that endeavor. And these point solutions are part of that. So to be precise and to be smart, these are programs that help your employees and their dependents first. And I think if you start there, you're going to get the impact that you're ultimately going to be looking for.
Yeah, and lastly, from clinical, using just that multi-collaborative approach, don't wait till the 11th hour to bring in the team to ask the questions. I cannot stress that enough. We have a multitude of experts that Hub has at your fingertips. Using that multi-layered approach is going to help transform those discussions and, take a lot of the stress and the extra work off of you as team members. You are not alone in this. You do not have to try and do all the data and the medical driven discussions or the vendor selections by yourself. We have a team of experts to help you. So that's basically what I always try and stress to people. You leverage the resources that are actively at your fingertips.
Those are amazing takeaways. Thank you guys so much. So with that, we're ready to wrap up. I feel so lucky to be able to moderate this amazing conversation today. So thank you so much to our experts and panelists that have joined us. And thank you for attending today's webinar. We hope you found this information useful and will join us for our next installment of our cost management webinar series. Next on board is going to be Resilient by Design, which is going to be available June 26th. Next is What If Medicaid Changes and How Do We Prepare for That, Wednesday, July 23rd. And then the Workforce Vitality Gap, What Employers Are Missing and How Employee Insights Can Fix It, will be on Wednesday, July 30th. If we did not address your specific question or concern in today's Q&A, rest assured we will pass them along to a Hub representative for follow-up. For those of you in attendance, continuing credits will be provided in your follow-up email along with a link to the webinar replay. And finally, a reminder to please fill out the survey before closing your browser. Your feedback is important to us and helps us develop future events. Thank you again for trusting Hub to help you navigate through these uncertain times. This now concludes our broadcast.